Welcome back to the Dr. Doug Show. Today I've got an interview for you that I think you're really going to like if you are looking for the best modalities, the best tools, the best things that you can do to help improve your bone. We're always looking for those things. And I met Dr. Adam Gavine at a conference several weeks ago now, and he was telling me about this new Shockwave therapy device that is lower intensity than what I was trained on and that I used in orthopedics, but has evidence behind it to support using it in the face of osteoporosis. So I was intrigued, and I said, "Cool, thanks." And we parted ways, exchanged numbers, and then he sent me an email with all of these studies listed. And I was like, "Oh, cool! This is something that might actually be interesting." So looked at the studies, I found it compelling, and I wanted to bring it forward to our audience on the Dr. Doug Show because I do think there's probably something to this. So if you're interested in learning more about shockwave therapy, how it could potentially be used for bone health and osteoporosis, take a listen to this interview. There's a couple of really interesting parts in here where we deviate a little bit into other uses of shockwave therapy and this particular device. The company is called the Wasabi Method, if you want to check that out. But we go through all of this stuff with Dr. Gavine. He provides some really great technical information, background information, and clinical experience. So I think this is a really cool interview. I think this is something that we might see a lot more of in the future, and I'll probably see Dr. Gavine back on the show in the future as well, as there's a lot to collaborate on. So hope you enjoy this interview. All right, Dr. Adam Gavine, so good to have you on the show. Give us just a little bit of your background, what your training is, and then how you got to where you are now, specifically with this device and this technology.
It's a pleasure to be on your show. Thanks for inviting me. So I'm a sports chiropractor. I've been working in Australia for the past 18 years. I am currently doing a master's of research at the University of Sydney. That's interesting and fun for me. But what we're talking about today is my company that I've set up with Dave Asprey, which I'm sure most of your listeners who would know about. He's quite well known, but we started a shockwave therapy company called Wasabi Method.
Can you tell us a little bit more about the Wasabi Method and kind of what is the mission of this company?
Our mission is basically, we kind of feel like we're Prometheus stealing fire from the gods because the device that we're selling, it's an FDA Class 1 device. So it's basically viewed as a massage device, but it's actually really a medical grade device. You can there are some contraindications. You can actually harm someone if you do the wrong thing. And we'll go through a couple of those contraindications probably later. A lot of these other companies that sell these devices, they refuse to sell to non-medical persons, which we think is kind of ludicrous because the FDA deems it okay. So, like, if your kind of governing body deems it okay, like, I don't understand why these other companies won't sell it. But we've kind of gone an extra step to put in some protective guidelines in there. So, for instance, we'll send you a safety module that has all the contraindications, has all the safety protocols in it before I actually send you the device. So when you go to buy a device, we get your order. I send you the safety module. You actually have to pass a quiz where you have to get 100%. So that way people can't say, "Oh yeah, I read it. I know all the things." It's like, no, you need to prove to me you know this stuff. That way I know for sure that you're not going to harm yourself or others. And then we'll send it to you. And then we also put the added kind of benefit of, we require that non-medical buy all the education. So our education comprises of 5 modules. So we have an upper body module, we have a lower body module, we have a men's sexual health module, a women's sexual health module, and then we have an more advanced techniques module. So we look at things like treating like the TMJ, we look at treating like skin conditions, dermatitis, eczema, cellulite. You can actually treat like burns, like after they've kind of settled down. You can treat like 3rd degree burns to help with the healing of those tissues. You can treat non-union fractures. and you can treat things like osteoporosis, which is one of the main things that you're interested in today.
Yeah, yeah, we're definitely going to get into that because that's you just made our audience's ears perk up there. So we're definitely going to get into that. Let's get a little bit more background here. So we call it a shockwave therapy device. That's what
Yeah.
people that have heard of shockwave therapy, we understand
Yes.
what that is to some extent, but it's not quite the same. And I was trained in shockwave therapy back when I was practicing orthopedics. And my impression of shockwave therapy is not particularly positive, mostly because it hurts.
Yeah.
And so, talk to me about what you guys did that's different than a shockwave therapy device. How did you adjust this thing so that it is something that can be used without anesthesia, but be
Yeah.
on a more regular basis? Because again, when I was using shockwave therapy, we would sedate people and use it,
Yeah.
even if it was light sedation, but we would knock them out and use it for things like plantar fasciitis and stuff like that in the
Yeah.
foot and ankle world. But how is this device different?
So ours is technically not a shockwave device. So by definition, to be categorized as a shockwave, it has to meet a requirement of 100 millipascals of pressure. So our device doesn't quite reach that level, but there's a therapeutic window in which, just like drugs, you as long as you're in that therapeutic window, you're going to get the therapeutic effect. So our device gets into that window. So a lot of people have this idea that it used to be like you have to make it hurt for it to work. And again,
Yeah,
I tell people it's like when you boil water. I use Celsius to make it easier. It's like if I boil water at 100 degrees, if I boil it at 105 degrees, that doesn't make it boil any better. It doesn't boil faster, or the vapor's not any better. It's the same. I've
right.
just expended more energy to get up to 105 degrees compared to 100 degrees. So that's kind of the essence here, and that's the kind of misconception people have. They're like, "Oh, higher is better," and it's like, no. As long as you're in that therapeutic window, you're getting the same result.
Yeah. Yeah. And I always joke this is an American thing, and maybe it's an Australian thing too. But
Yeah.
people tend to just think more is better, harder is better, more painful better. And
No,
I find that not to be true in so many things.
it's actually
Um,
the opposite with this, because if you go too high energy, you get into the lithotripsy levels. Now,
mhm.
lithotripsy, if you know what that term is it's what they use to break up kidney stones.
Yeah.
So if you go too high energy, it has a catabolic effect. It breaks down tissue.
Right.
Okay, so there's these windows, and if you go too far along the spectrum, if you go too high energy, you will cause breakdown of tissues, which is
Yeah.
not what we want when we're treating musculoskeletal stuff.
So then let's talk about what is the actual impact on the tissue. And then this will lead us into bone health. But like when you're using this device, like where would somebody use it? What's a clinical application? Give us an example. And then like what is the thing actually doing to the body or the tissue that it's treating?
Okay, you'll find out I'm big on analogies. So I
Yeah.
tell people, imagine if this is you, my left hand, and this is a gong in my right hand. Now, if I hit that gong really hard, you will feel those sound waves from that gong actually hit you. Okay?
Mm.
So those are essentially that's what we're doing with the device. So it looks like a gun. There's basically a barrel, and we have controlled pulses of air through there's a compressor, there's compressed air, and it's all pneumatic, and there's controlled pulses of air that push basically a bullet. The bullet hits the gong at the end, which is the applicator tip, sends shock waves or radial pressure waves, which our device creates. Those go into the tissue, and when they go into the tissue, they cause physiological changes in the tissue that they're applied to. Now, the caveat there is that you have to have contact gel, because the shock waves or radial pressure waves are, I'm going to use the term synonymously here, they don't travel through air. So you'll lose 99% of the energy if you don't have contact gel. So it's very similar to like ultrasound. You need the gel.
Okay, so interesting. So then the shockwave enters the tissue,
Yeah.
and let's just use a musculoskeletal application. So let's say you're
Yep.
treating like we talked before we hit record, like about a bicep or a deltoid
Yep.
treatment. So like what would that clinical application look like? And then what is the device actually doing to that tissue?
So what um, what it's doing, those sound waves or the pressure waves are causing physiological changes to the tissue. So your body's it's like a signal to the body. So I tell people it's like if I go clean up on aisle five, clean up on aisle five. So your brain gets that signal and then it releases all these different like growth factors and enzymes and all these things that cause tissues to repair and heal.
Of course, everybody has muscular things,
Yeah.
and that's of interest. But
Yeah.
ultimately, our audience is here to improve their bone health.
Yes.
So, talk to me about the impact on bone specifically, because it makes sense to me. If we have this
Yeah.
pressure thing and I stick it on a muscle, it's going to have an impact on the muscle. That seems
Mhm.
pretty intuitive.
Yeah.
But bones are deep, especially
Yeah.
the ones we care about, like the spine and the hip. So
Yeah.
bones are deep. Bones
Hmm.
are also, most people think of bones are like, well, it's this like hard
Yeah.
thing. A shockwave therapy is not going to do anything to
Yeah.
it. Like, what is the impact on bone that you guys have seen?
So with bone, it's more painful. So the radial pressure waves kind of reflect off of bone, but they
Mm.
absorb a certain amount, and that again that causes this signaling pathway. And to make it real simple, our bones have kind of two major types of cells. One, as you know, Dr. Doug, is the osteoblasts. So they create new bone. Okay. And then you have osteoclasts, and osteoclasts break down bone. Now, ideally, they work at the same level. So if osteoblasts are working at the same rate as osteoclasts, you don't get a net gain or a net loss of bone. It just stays the same, which is what we want, because you don't want bone to keep growing. Otherwise, you have some bone problems, right?
Right.
And vice
Yeah.
versa. If you're losing bone, you get osteopenia or osteoporosis. What the device does, it actually causes a proliferation of osteoblasts. So I'm telling your body, make more of these, make more of the osteoblasts. And it actually does the opposite for the osteoclasts. It causes an inhibition of those cells which break down bone. So if you have an inequality where you're breaking down bone at a faster rate than you're building the bone, then we want to bring that back to level that out so that you end up with normal bone density.
Yeah. And that's some of the systemic approaches that we use because we don't lean heavily on the pharmaceutical industry in our practice. So, we are
Mhm.
looking like how do we fix that imbalance? Because
Yeah.
you described it accurately. If you're breaking down more bone than you're building, over time you're going to develop osteoporosis. Depends on
Mhm.
how quickly and your starting point. So then
Yep.
how can we shift that balance? Not like a pharmaceutical which just clobbers the cells. We don't want to
Yep.
do that. That's not natural and sustainable. But how
Mm.
can we shift that balance day after day, month after month, so that you can then
Yep.
reverse osteoporosis naturally, which we see, and you can get headed in the right direction. So any tool that does that is a tool that we're interested in. And
Yep.
some of the things that we talk about, like progesterone, can help proliferate osteoblasts.
Mhm.
Estrogen can help to slow down osteoclast function and help proliferate
Yep.
osteoblasts. So we
Mhm.
have these tools that we can use, but because we're using natural methods, they
Yeah.
are not as powerful as like an anabolic drug like Forteo or Temlos or something like that. So
Yep.
then the more we can stack, the better. And so this is where the research was interesting for me. One of the studies, and again, for anybody who's research heavy, we're going to drop links to all these studies. But one of the studies that stood out to me was a study that looked at using bisphosphonate drugs, which are my least favorite drugs for
Yep.
osteoporosis, but bisphosphonate drugs, and then in one group, and then bisphosphonate drugs plus this type of therapy in another group. And the
Yep.
impact was that the bone mineral density at the end was clearly better in the group that had the additional therapy. And it makes sense clinically to say, well, if we can stimulate osteoblast, if we can encourage them to do the thing that they're going to do, it's going to stack and be better than just using a drug alone. And I think that's going to be true across the board. So give me a sense of the research that you've done or cases that you've seen. I know you're not doing the research, but research that you've
Yep.
read or the cases that you've seen, and the impact on bone that you think that we're going to see if we were to use this.
Yeah, so it brings to mind a few studies that I read. One, I did a webinar a few years ago, and it was looking at non-union fractures.
Hmm.
Um, so for your audience, if they're not aware what that is, it's basically bones that won't knit together even after weeks and weeks. Most bones take, 6, 8 weeks to kind of knit together. These bones, because of either too much osteoclastic activity or not enough osteoblastic activity, or hormones or some other physiological problem, the bone's just not knitting together. So we can stimulate that specific area with these radial pressure waves or shock waves, and that's been clinically proven time and time again. This has been in the literature for like 25
Yeah.
years.
Right.
Um, the one that I showed in this webinar was they were looking at it was the metatarsal, which is the long bone in the foot, and the gold standard is what they call intermedullary fixation,
Hmm.
which I'm sure you know about, which is
Yeah.
very invasive. You have to cut the person open. You got to put a screw through the bone, and then you got to put it all back together and then close it all up. And that's
Yeah.
that's weeks and weeks of rehab, and it's expensive and it's invasive, and you can run into problems. The study looked at treating using shockwave therapy in comparison to the gold standard with intermedullary fixation, and the results ended up after 6 or 12 months were the same,
Yeah.
except one cost you thousands of dollars less. You didn't have to take time off work. You didn't have to go through insurance. All this rigmarole is
Yeah.
avoided. And again, it's non-invasive.
Yeah, and so I did that surgery. I did that surgery a lot because foot and
Yeah.
ankle was my subspecialty. So I was
Yeah.
a metatarsal guy. And yeah, I can tell you that that surgery does work. It helps to get the bones to heal. It provides
Yeah.
compression. It aligns
Yep.
the bone, and that's
Mhm.
great when it goes great. Except that it is
Yeah.
expensive. There is risk, and the thing is, when you stick a screw in a bone, it changes the bone, right?
Yeah.
So a lot of times we take that screw out,
Yeah.
which then you have two surgeries.
Yeah.
And the other issue behind that is like if you have a screw, if you have the head of a screw, people think of just think of any like regular looking screw. We use screws that don't look that different than that, right? Like
Yeah.
they're fancier and they're whatever,
Yeah.
they're sterile and they cost $2,000.
Yeah.
But it still looks
It's
like a screw.
carpentry.
So
It's
imagine like
carpentry you guys do.
right. Yeah. I mean, it's fun, right? I mean, the
Yeah.
OR is a great place. We've got great tools. But
Yeah.
this imagine sticking this screw head up against the side of your bone where your tendons are and like your muscle
Mhm.
runs across it. Some people are symptomatic, not everyone. We try to put it in a place that won't bother people, but it can bother people.
Yep.
So one of the things that was always a challenge for me as a surgeon is that we say, especially in the US, I'm not that familiar with the Australian healthcare system, but in the US, we are very much, fee for service.
Yeah.
So non-operative care is not lucrative as a surgeon.
Yeah.
So pursuing these, non-operative pathways to get things to heal requires you to have incredible integrity to
Yeah.
say like I'm going to do the best thing for my patient regardless of my overhead and income. And that's a
Yeah.
really challenging subconscious decision or conscious for some people to really go down the pathway of saying, look, I'm pretty confident we can use this tool. Let's get
Yeah.
this thing to heal this way, and you're going to be better off.
Yeah.
That's so challenging in the traditional medical model. But when you get outside of that, and now
Yeah.
I tell people, look, let's do everything we can to avoid surgery. Sometimes
Yeah.
you need surgery, and that's great that we have those tools. But what are the things we can use to help avoid potentially a side effect or a complication from a surgery that we ultimately didn't need? And now I'm in a much different position to be able to make recommendations like this to say, look, the bone's aligned. We just need it to heal. Let's look at other tools.
Mhm.
And especially if the surgery is going to be the same 6 months from now as it is now, man, let's get this thing to heal without it.
Yeah. Yeah.
So
And
it's
and you always
totally
have that
different.
as a plan B. Yeah, the surgery can always be a plan B, I tell people. Like, you can always try the conservative method. Worst case scenario, it doesn't work. You do the surgery anyways, right? So
Yeah.
either way,
Yeah.
you kind
So
of win, right?
So then let's pull that further. And so a non-union is kind of it's a unique situation, and I dealt with
Yep.
non-unions, and non-unions aren't fun. We can
Yep.
get them to heal with certain things.
Hmm.
Ironically, some of the same things we do for osteoporosis. So just to give
Yep.
a couple of examples, like Forteo is the anabolic drug for osteoporosis, right?
Hmm.
Forteo we can use to help heal bones that have
Hmm.
non-unions, right? Because it stimulates this metabolic approach. So we're doing it totally
Yep.
different pathway. We're doing it
Yep.
that way. We optimize vitamin D levels. We use other nutrients, right? So we use a lot of the same tools for a non-union as for osteoporosis. So
Yep.
then how could this potentially be used for osteoporosis? Because osteoporosis, the way that I talk to people about it is it's a systemic problem.
Yeah.
Right?
Yeah.
It's your bone all over your body. You don't generally just have osteoporosis of your lumbar spine or of your
Correct.
hip. You have
Correct. Yeah,
osteoporosis, period.
it's a systemic. Yeah.
So
Yeah.
yeah, so as a local device, how does this have an impact on the whole body?
Yeah, so when we met at the BK Live conference, you asked me this question, and actually I didn't have a good answer. So this is why I love going to conferences and stuff because I meet people like yourselves that ask me these questions, and it forces me to learn more. And I found a study that I've sent you, and we'll put that in the show notes, I'm sure, where it causes a systemic effect. So it's not just so I can treat your radius in your forearm, and it will have a systemic effect on osteoclastic activity. So it increases the NF kappa B. It blocks the differentiation of osteoclasts in the body throughout the body, which is really cool because I wasn't aware of that. So you can treat. So the cool thing is you can treat almost anywhere. So you can treat. So say when someone's really sensitive in their arm, well, you can just treat their tibia or their fibula, or you can just pick some bones and just treat randomly. You don't. There's no specific. Well, at least I'm not aware of any. It's like you get the best result if you treat this bone. I'm sure it's different for every person, but as long as you're treating a bone, if you're
Yeah.
treating someone's quad, you're probably not going to get the same as if you go right on a prominent bony landmark.
I was thinking about it in relation to one of the therapies we talk about a lot, which is whole body vibration, which is a totally
Yep.
different modality, right? What
Yep.
you can see is that there are some modalities that the impact is so small that you only see a local impact. So, like, for example, there's a device called the Merodyne vibration plate, which is a very low amplitude, high
Yep.
frequency device. And if you look at the research, there is research that says that it can help heal like a non-union of the tibia, right? If you're standing on this thing with a non-union, it has an impact, but it
Yep.
doesn't seem to have an impact higher up. But if you
Okay.
look at other devices, like the power plate devices, something that has a bigger amplitude, even though
Yep.
you're getting this response from the body in the lower, if you're standing on the plate, you're getting
Yep.
this response in the lower body, you're going to see the impact of the spine and the other bones. And some people would say, oh, well, it's because you're feeling that impact through your skeleton. But I don't know
Mhm.
that that's necessarily true. I think there is a systemic response that occurs, and you're getting signal to all of the bones of your body. Because there's no reason to think that a whole body vibration plate would have an impact on the forearm unless you're doing push-ups on it, right? But yet we see the bone get better throughout the entire body, not just in the area that's on the plate. So I think it's totally plausible then to say it's possible to have a local device that is going to send a systemic response to all of the bones of the body. Is that
Yeah,
kind of what you're saying?
and that makes sense because like when we talk about exercise, like if I do bicep curls, I don't just get stronger in my bicep. Like I cause release of testosterone, growth hormone in my entire body, right?
Yeah.
So and they've shown that for running, for instance, it's actually the muscles that cause the bones to increase in density. It's the muscles contracting that cause the increase in density for like the tibia when
Mhm.
people are running and stuff. So it's quite fascinating to learn these things.
Yeah. Well, the bone is such an interesting tissue because it responds to, it responds to impact, it responds to muscle pull, it responds
Yeah.
to your diet, it responds to
Yeah.
all kinds of stimuli. So the bone is a really sensitive organ, which is, I think,
Yeah.
really
And a
misunderstood.
lot of a lot of people don't realize that. They think bones are really hard, but that's only when they're taking outside of the body, when they're dried. Bones are full of blood, and they have a capacity to bend and
Yeah.
move. Because if they
Yeah.
didn't, we'd be fracturing bones all the time when
All
we
all
go
the
for
time.
when we
Yeah. They're
run our
actually,
when we run or
it,
jump. They deform and they spring back. They're like
yeah.
springs.
You can really see that when you look at the osteogenic loading studies. If you look at somebody who's pushing against a device that really doesn't move, and you
Yeah,
can see, especially at the end range of motion of, say, the knee joint, for example, your
yeah. You
bones
see
are they're
a bowing
yeah, they're
effect.
bending in front of you, right? And it's
Yeah,
almost creepy to look at it and be like, oh
yeah,
my God, like that,
yeah,
let's not
yeah,
do that again. But that's what
yeah,
your bones are doing all the time, and we just
yeah,
don't appreciate it because it's so subtle and it's layered underneath your skin and muscle. So then, all right, so correct me if I'm wrong, but if we haven't seen the study that I want to see, and the study that
mhm,
I want to see is a study looking at a population of people with osteoporosis using
mhm,
this device as a single intervention in a
mhm,
specific spot over the
mhm.
course of 12 months with DEXA or REMS or quantitative CT or whatever
Yeah,
before and after. Like that study hasn't been done, right?
yeah. Let's do it. Let's do one.
Let's do it. Let's do it. We need couple $1 million
We'll
and
be
an academic center.
we'll be pioneers. We'll be
Yeah.
pioneers.
Well, if anybody wants to do that study, I'm happy to be an investigator on it and happy to help design it. So just putting that out there for all of our science people that are listening to this video. So, all right. Well, in the meantime, though, tell me about like what are you guys doing with this device? How are you getting it in the hands of people? And if somebody wants to pursue it, how could they pursue it? We'll talk about home use in a minute, but what most people are going to do is find it somewhere. So how do people find
Yeah.
it?
So you go to our website, wasabimethod.com, and you'll find links where you can email us. You can actually do often I do weekly talks, so you can join one of our meetings and you can actually speak to me like what we're doing on this call. Um, yeah, so I do that virtually weekly if we get enough people that sign on, and I can answer any questions you have. I can go through some of the science. So a lot of these other companies, like I never met the CEO of the company I worked for 14 years.
Hmm.
I'm the founder and CMO of our companies, and you know that's the benefit of our company because we're small is we give you more personalized care. We will make sure you have the device. You get an hour with me when you buy the device. I will any questions you have, I can answer. I'll run you through how to set it all up. Any troubleshooting you have. So that's kind of the level of care and customer service that you get when you buy our device. And again, like I said, these education modules that we offer, they are very comprehensive. We go through pretty much every muscle in the body, and we tell you exactly how to treat it. I show you exactly how I would treat it. I show you tips and tricks. I teach you things about these muscles that you might not know about. Um, yeah, just tons of really good information. Oh, we have some really good anatomy pictures. We have like 3D videos showing you all around that the muscle. They're really I'm very proud of the modules. I didn't think it'd be that much work. At first, I'm like, oh, I can do this in like a couple months, and I've been working on it all year, and I'm still not done. And it's well, basically, because I made one for practitioners only, and then I'm like, oh, the non-medical people, they won't understand all the Latin and all the, so I made a totally different module for non-medical, so where I use simple terms, I don't use these big medical terms, so that people know how to treat themselves.
Yeah.
So it's no one else does this stuff.
Well, and that's a great segue to home use. So let's say somebody really wants this thing in their house. They want to use it for musculoskeletal. They want to use it for
Yep.
osteoporosis.
Yep.
Um, so someone can buy this for home use, but give us a sense of like the cost and is it really feasible for someone to do that?
Yeah, so our device we sell it's $15,000 US for the device and all five modules. Now, if you're non-medical, we require that you buy all the education. There's a $200 shipping fee, and then there's state taxes, which is dependent on what state you live in. So all up, you're looking maybe 15 and a half to maximum 16,000 for it to be at your house.
Yeah,
Um, the caveat though is you're only allowed to treat yourself. So legally, you can't if you don't have a license to touch and you don't have insurance, you shouldn't be using on other people because if you harm them, they can sue you. So I
sure.
just make people fully aware that we make that very, very clear that if you buy our device and you're non-medical, you can only treat yourself.
Yeah.
So
Yeah, that's always a danger in my household because I get sent all kinds of fun toys. And
yeah,
I'm like, people come in, they're like, "Oh, can I try this?" I'm like, sure. Let's do it together. People
yeah,
have come
yeah, yeah,
downstairs and people are, vibrating on the power plate. They're like sitting on
yeah,
it. They're,
yeah,
they like have their
yeah,
head on it. I'm like, oh my God,
yeah,
please
yeah,
don't do that.
yeah. No, yeah.
Okay.
So, but the other thing is that this technology is not new. So that's the beauty of it. It's been around for 35 years. So we have tons and tons of data showing how effective it is, and not only that, but how safe it is. Like you would actually have to try to harm yourself to actually, if you stuck it on your eyeball at full power for like 10 minutes, yeah, you would cause some damage. But, if you just go on like your quadricep, like it's really hard to cause any problems. And I've been using this for 14 years and I've looked at all the literature, like one randomized controlled trial I looked at where they're treating knee osteoarthritis. That's another thing we should talk about is
Oh yeah.
osteoarthritis. It's fantastic for that.
Yeah, it's
There's
a big one.
tons of studies on the knee. So in this particular study, there were 19 RCTs included in the systematic review, almost 2,000 patients, and there was zero side effects. Which is like when I teach this at seminars, I'm waiting for everyone to get up and do like a standing ovation when I show that because that's unheard
Mhm.
of. Like I'm sure
Right.
you've never ever seen a drug trial where there was zero side effects. It just can't happen.
Right.
And
Or
and,
any,
and
I mean, any intervention, right? I mean,
yeah,
that's
any
and that's
intervention.
always the question of like what is the risk benefit? But let's
Yeah,
let's then like let's shift into like what are the contraindications? So okay, so you mentioned
yeah,
don't do it for 10 minutes on your eye. Check.
yeah, yeah,
What are some of the other contraindications to the
yeah.
device if
So
somebody's thinking about this?
yeah, so pregnancy is one.
Hmm.
Um, and that's just because we haven't done any studies showing that
Right.
its safety profile on pregnant women. Kids, anyone under 18. The main reason is because of the growth plates. We're worried
Yeah.
about disrupting them or causing changes in the growth plates. If someone's on any anticoagulants, blood thinners of any type, if someone has any type of hemodynamic disorder, so like hemophilia, stuff like that, where their blood doesn't
They're gonna
clot
bleed.
properly.
Mhm.
Any type of thrombosis, so like deep vein thrombosis, stuff like that. If they've had a cortisone injection, now the caveat there. So if you've had a cortisone injection and that was 3 months ago, it's perfectly fine for me to treat that area, but it has to be at least 6 weeks.
Mm.
So if you had a cortisone injection 2 weeks ago and you said, Adam, can you treat that? I can't. But I can treat your other shoulder if you haven't had a cortisone in that one. So
Yeah.
that's more of a local thing. Also, if you have a tumor, so like a local tumor, but even with that, say someone had like a breast lump or something like that, I can treat their plantar fascia
Hmm.
as long as because it causes it releases all these growth factors and stuff So we don't want to go right over a tumor and make it grow. So that's the reasoning there.
Interesting.
Um, have I mentioned all of them? Oh, and you can't go over the lungs because it
Oh,
causes it
yeah.
causes air it causes air to expand. So it
Mhm.
can yeah, it can. It's like I have peers that tell me they work over the lungs and never had a problem, but that's originally how they discovered shockwaves as these soldiers from World War II were coming back with lung damage from
Yeah.
grenades and bombs going off near them. So again, that's what we're talking about, the energy level. Those are massive shockwaves.
Right.
So they're destructive. So
Yeah.
even at the low level on over the lungs, you can cause a bit of trouble. And so that's why we just tell people just avoid it, and then
Right.
you won't run into any problems.
Yeah. Okay, good. Well, I mean, that would be most people would not run into any of those issues. So I think it's probably something that's safe to use. And then let's talk about future direction. So we mentioned that if anybody wants to do the study I just said, let me
Yeah,
know, reach out to us. Happy to be a part of that. Adam would be
yeah,
happy to be a part of that.
yeah.
But what else? So what else can we do? You mentioned that we're probably going to set up some specific centers. Like, what's the future direction of the device in the company?
Yeah, so one thing I kind of didn't allude to too much is we talked about the men's and women's sexual health. So with
Hmm.
that, we're not allowed to make medical claims, um, but there are studies in countries outside of the US that show clinically that shockwave helps with a lot of these conditions, such as erectile dysfunction, chronic pelvic floor disorders, um, dyspareunia, which is basically painful intercourse for females, anorgasmia, which is women that can't achieve orgasm. So, and a lot of this is based on the fact that we're causing angiogenesis, which is the new formation of blood vessels. So that's if we'll geek out a little bit here and talk about
Let's
some
geek
of these
out. Yeah.
we'll talk about some of these growth factors. So one of the main ones is VEGF. So that's vascular endothelial growth factor. So that stimulates angiogenesis, which is the new formation of blood vessels. So it's different from like if you just put like thermotherapy or heat therapy on an area which causes local increased blood flow. This will cause your body to lay down new plumbing in the area. So if someone has vascular erectile dysfunction, this will make a tremendous difference with that condition, such to the fact that like men often don't have to take their Viagra and stuff like that anymore. So it's non-invasive for that. The clinical research shows about 6 treatments, so you don't need to have ongoing treatments. They also recommend doing like a once a month for about 6 months follow-up. So you're looking at about 12 treatments all up to get a significant change in that condition.
Yeah, that's interesting. I mean, sexual health is such an interesting topic. It's not. I think it's not talked about enough
Yeah.
because there are so many people that suffer from it. Men. I think it's easier to talk about erectile dysfunction, sort of like mainstream, but women for sure.
Yeah.
It's not a good conversation around it, and I think a lot of women they just don't even bring it up.
Yeah, well, like
Just
I think it shouldn't be taboo because like sex for most people is important and their relationship and their happiness and psychologically and emotionally, all these things.
yeah,
So like if a woman has never orgasmed before, well, she's missing out on a a really big part of sex, and we can help with that. And if a woman just writes herself off and says, "Oh, I just can't get to O Town," well then
right,
that she's doing herself a disservice, because there are
yeah.
there are ways we can help with these things.
And it's going to have a negative impact on intimacy and relationships, and
Yeah,
it's a
exactly.
problem that really permeates outward from there. So then,
Yeah. And just to allude a little
yeah.
bit more, I've actually been we've just kind of hired on two world leading experts in these fields. So I have a PhD level physiotherapist here in Australia named Jo Milios, and she wrote her thesis on erectile dysfunction, and she was actually just went to a bunch of conferences in the States last month, and so she's joining our team. And we also have a gynecologist that I met at one of the conferences I was at last month, and she just gave me the thumbs up today to join us. And when we do some face-to-face conferences next year for Wasabi, she's going to be on the team. So we're going to have some world-leading experts in these fields working with us. We're going to start doing some case studies and really trying to push this to the next level.
Yeah. Well, that's awesome. So then since we brought it up, I think we need to compare it then to some of the other more popular devices
Hmm.
for sexual health. So I
Yeah.
was at a conference, it actually was an A4M conference, and
Hmm.
it was on BHRT. So sexual health was talked about a lot.
Yeah.
And there was a GainsWave
Yeah.
device, and then the new version, which I think is called OmniWave, if I'm not
Yeah.
mistaken.
Yeah. Yeah.
So
There's
how does
a
this
few of them.
yeah, so how does this then compare to like those types of devices? And I mean, if you don't know, that's fine because I know they're not yours, but
Yeah.
how does this compare to those?
So again, there's two main types of shockwave. One is the radial device. So ours is a radial device. The difference is, so radial device, the shockwaves go out in like a conical or divergent array. So the highest energy is right at the skin level, and then as it penetrates, the energy dissipates. Focus device does the opposite, so it comes into like a pyramid or a convergent array, and so its maximum energies deep in the tissue. So it depends on the spacer that you use, but usually it's 40 to 80 millimeters, which is like you're talking 2 to 4 inches deep, right? So it depends on what you want to treat. For instance, uh, the physio I've had help me do the videos for our men's sexual health. He uses it. He uses the radial, and he says with treating pyrones, which is plaques that form on the penis, it's actually better because the plaques are right. They're superficial, so you actually get more energy at right at the plaque, whereas the focus kind of goes through it, and the maximum energy's like deeper in the tissue, not where the actual lesion is. So there's different things. So it's more about the application. So the focus is more. I tell people it's like a sniper. So you got to be very accurate with it, because if you're not right on the tissue you're trying to target, you're not going to get the therapeutic effect. Whereas with the radial, there's a bigger sweet spot. It allows for you not to be as precise with it, but you don't quite get the depth of penetration. And the other thing is the Focus is not a class one device. You actually need to be a medical practitioner of some form to
Right.
actually use it. So it's not applicable to everyone. You can't buy it as a non-medical.
Right. Yeah. And I know some providers that have these devices, and the
Mm.
results are good. I think the challenge with the GainsWave device that I've heard is that it hurts, and so it is imagine I've not experienced this personally, but imagine if you're treating like a penis or you're treating the female genitalia,
Yeah.
and it's painful. You have to cover it with an anesthetic,
Yeah.
an anesthetic, what is it,
A
cream or
local.
gel.
Yeah.
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 or injection, and there's different ways to do it, but
Yeah.
yeah, that's a big hurdle for a lot of people. Guys don't
Yeah.
like rubbing a gel that's going to make their penis numb and then use a device and then they can't feel it for a while. That's very
Yeah.
disconcerting. So
Yeah. Well,
uh
again, it depends on your pain tolerance. It depends on, if, again, it's non-invasive, so it's not going to cause any harm. It's just going to hurt, kind of thing.
right. Yeah. Well, all right. So, nice aside, sexual health,
Yeah.
always fun to talk about. So then
Yeah.
let's wrap this up and just remind people, where can they learn about this device? Where can they learn about the work that you're doing? And any last thoughts that you have?
Yeah, so they can follow us on Instagrams, our main social media. So it's at Wasabi underscore method. Also, our website is wasabimethod.com. Um, it'll have like email where you can email us and you can sign up to those weekly courses that I do. And yeah, what else? What else do I want to say? Yeah, it's just it's a great technology. It the beautiful thing is that we always get at seminars is people actually can't believe the effects because it doesn't take a long time. It's almost instantaneous. It takes 5-10 minutes for me to get a therapeutic change on the tissues, and people walk away. They actually can't believe it. They're almost dumbfounded because they're like, that can't be real. But one of the things I forgot to mention about the physiology is it causes a local analgesic effect. So
Mm,
it causes the nociceptors or the pain nerves in the tissues to release what's called substance P. And so it's similar to if you eat something super spicy, like your mouth kind of burns and then it kind of goes numb after and you can't really taste anything. So it's a similar principle, and that's how it helps with the inflammation, is it decreases what we call neurogenic inflammation.
mm.
So you can use it as well. The other really cool thing is you can use it with other modalities. So like I have a laser, and with the laser, it works on the COX-2 pathways, which is kind of like what um, ibuprofen helps with. So what you can do with some people is you can use the laser first, and that will give you a slight analgesic effect. So some of my patients, like, they can't handle it on their plantar fascia. I'll use the laser first, and then I'll just do a little soft tissue. It takes about 5 minutes for the laser effect to kick in. And then I can actually use the shockwave on them because I've got a bit of a therapeutic analgesic effect, and then they can tolerate that higher level. So that would be something we're gonna look at for treating the genitalia as well, because if it's painful, we can use the laser first, and then a few minutes later, then we can use the shockwave and not have that level of pain.
Yeah, no, that's really cool. I appreciate that background. So I think let's call it here, and
Yeah,
then we'll see what the response is like, and if we need to do a part two, then in the future we'll do a part two. So
yeah,
thank you so much for your time. I know it's late. It's now after 11 o'clock in Australia where
yeah,
you are. Time to get to
yeah,
bed. You got a big day
yeah,
tomorrow, and my day's just starting. So
yeah. All right.
yeah, yeah, I
Thank
love
you
it.
so
So
much,
thank
Doug.
you again.
I appreciate it. It was fun to come on here and talk about nerd out with you.
Yeah. All right, cool. Well, hopefully we'll get a chance to do it again, and look forward to hearing some results from the device over time.
Awesome. Yeah, we'll keep in touch.
All right. I hope you found that interesting. And, I wish that this device was more available at this point, but I think you are going to see more and more of these pop up because it is, as we were discussing, something that is much more tolerable than a traditional shockwave therapy device. I think we're going to see the utilization of this as other devices in the market, like we talked about, OmniWave, GainsWave, et cetera, are really gaining traction in the sexual health space. We're going to see other applications as well. So hopefully we'll get some more research done on this device to really say whether or not this is a good thing to do from the whole body perspective, but certainly localized, I think it could really have an impact. Now, if you are struggling to put together your program and you're thinking, is this my thing? I don't know that this is my thing, but I don't know what the heck to do. Please come join our masterclass. If you haven't done our masterclass yet, it is free. The link is in the description on YouTube and show notes in the podcast. We go through the common myths, misconceptions, and help you to drive your own path forward when it comes to bone health. So I'd strongly encourage you to come to that masterclass. If you've been to the masterclass and you're looking for that next step, it very well might be joining an awesome community like the Osteo Collective, where we now have hundreds and hundreds of people who are DIYing and supporting each other, improving bone health. We see success after success in there. So if you're looking for the right community, people that are doing it well and offering great advice, please consider our Osteo Collective. Again, links in the show notes and in the description on YouTube. All right, see you in the next video.